Hi everyone, this is the second hour of the medical terminology 2. So previously I talked about the digestive system. Now today I'm going to talk about the respiratory system. Key terms: cytoplasm. Here cyte means cell, plasm means formation or growth. So cytoplasm is all the material within the cell membrane other than the nucleus. Carbon dioxide, CO2, granuloma. In here, granule means granule, oma means tumor. So this is any type of nodular inflammatory lesion, usually small. And mucosa is the moist tissue layer lining hollow organs and cavities of the body that open to the environment. It is also called the mucous membrane. Mucus is viscous, slippery secretion of mucous membranes. Nares is nostril opening to the nasal cavity. Oxygen. pH, respiratory failure. This means inability of the cardiac and pulmonary systems to maintain an adequate exchange of oxygen and carbon dioxide in the lungs. Septum is a wall dividing two cavities. Sputum is secretions produced in the lungs and bronchi. Status asthmaticus. This is the condition of severe prolonged asthma attack that does not respond to repeated doses of bronchodilators and may lead to respiratory failure and death. Surfactant. This is a lipoprotein that decreases the surface tension of alveoli and contributes to their elasticity, thereby reducing the work of breathing. Now, I'm going to talk about the anatomy and physiology of the respiratory system. The respiratory system is responsible for the exchange of the respiratory gases, oxygen and carbon dioxide. Oxygen, as you well know, this is an essential for life. This is delivered to all cells of the body in exchange for carbon dioxide, CO2, a waste product. The cardiovascular system assists in this vital function by providing blood vessels, the pathways for transporting these gases. If there is a failure or deficiency in either system, then this means disruption of homeostasis and oxygen starvation in tissues that may result in death. Breathing or ventilation. This is a very important function of the respiratory system. The lungs and airways bring in fresh oxygen-enriched air and expel waste carbon dioxide. Breathing is an important method of regulating the pH of the blood, thereby maintaining homeostasis. Now, I'm going to talk about the upper respiratory tract. Breathing process begins with the inhalation. Air is drawn into the nasal cavity from the outside. This nasal cavity is a chamber lined with mucous membranes and tiny hairs called cilia, in which air is filtered, heated, and moistened to prepare it for its journey to the lungs. And the nasal cavity is divided into a right and left side by a vertical partition of cartilage, which is called the nasal septum. Pharynx or throat. Air passes from the nasal cavity to a muscular tube that serves as a passageway for food and air. There are three parts for the pharynx: nasopharynx, oropharynx, and laryngopharynx. There are also adenoids or pharyngeal tonsil. This is a collection of lymphatic tissue within the nasopharynx. And palatine tonsils, just tonsils. These are located in the oropharynx and protect the opening to the respiratory tract from microscopic organisms that may attempt entry by this route. The larynx, this is a voice box. This contains the structures that make vocal sounds possible. The epiglottis is a leaf-shaped structure on top of the larynx that seals off the air passage to the lungs during swallowing. It ensures that food or liquids do not obstruct the flow of air to the lungs. Trachea is the windpipe. The trachea is composed of a smooth muscle embedded with C-shaped rings of cartilage, which provide rigidity to keep the air passage open. Here, this figure shows the anterior view of the upper and lower respiratory tracts. From number one is nasal cavity, and also you can see the nose. And adenoids is located in the posterior part of the nasal cavity. And also there are three pharynxes: nasopharynx and lower oropharynx and laryngopharynx. And inside the posterior part of the oral cavity, you can see the palatine tonsils and also epiglottis. And the next one is you can see the next airway, larynx, and around the larynx there are glottis and vocal cords, and also the air goes down to the trachea, and then there are two bronchi, right and left bronchus, and then the air goes into the bronchiole. And as you can see here, there are two lungs, the right lung and left lung. The right lung has 3 lobes, and the left lung has 2 lobes. And the bottom of the chest, you can see the diaphragm, which divides the chest and abdomen. And the terminal part of the bronchiole, you can see the alveoli. Okay, so these alveoli exchange the oxygen and CO2, and between them there are many blood vessels and capillaries. And in this alveoli, the exchange of gases occur. And I'm going to talk about the lower respiratory tract. The first one, the bronchi. The trachea divides into 2 bronchi. One branch leads to the right lung and the other to the left lung. Here, the bronchi is the plural form and the bronchus is the singular form. The bronchi are composed of a mucous membrane. Mucous membrane traps incoming particles and embedded with the cilia. Move the entrapped material upward into the pharynx, where it is coughed out, sneezed out, or swallowed. The bronchi contain C-shaped rings of cartilage. And bronchioles, each bronchus divides into smaller and smaller branches, eventually forming bronchioles. And the terminal part of the lower respiratory tract is alveolus. The alveoli is the plural form. So tiny air sacs are formed where bronchioles terminate. The alveolus resembles a small balloon because it expands and contracts with inflow and outflow of air. There are many pulmonary capillaries, and there are several lobes of the lungs. There are 3 lobes in the right lung and 2 lobes in the left lung. And also there is a mediastinum. This is the space between the right and left lungs, which contains the heart, aorta, esophagus, and bronchi. Pleura is a serous membrane that envelops the lobes of the lungs and folds over to line the walls of the thoracic cavity. There are 2 pleura, visceral pleura and parietal pleura. The visceral pleura is the innermost membrane lying next to the lung. The parietal pleura is the outermost membrane which lines the thoracic cavity. And between visceral and parietal pleura, there is a pleural cavity. This pleural cavity contains a small amount of lubricating fluid, which permits the visceral pleura to glide smoothly over the parietal pleura during breathing. The ventilation depends on a pressure differential between the atmosphere and chest cavity. There is a diaphragm. This is a large muscular partition lying between the chest and the abdominal cavities. The diaphragm assists in changing the volume of the thoracic cavity to produce the needed pressure differential for ventilation. When the diaphragm contracts, it partially descends into the abdominal cavity, thus decreasing the pressure within the chest and drawing air into the lungs. This is inspiration. When the diaphragm relaxes, it slowly re-enters the thoracic cavity, thus increasing the pressure within the chest, and air leaves the lungs. This is called expiration. And also there are intercostal muscles. They assist the diaphragm in changing the volume of the thoracic cavity by elevating and lowering the rib cage. Respiration is the overall process by which oxygen is taken from air and transported to body cells for the metabolic process, while carbon dioxide and water, the waste products generated by these cells, are returned to the environment. There are 4 processes of respiration. First, ventilation, which is breathing. The largely involuntary movement of air into, which is inspiration, and out of, which is expiration, the lungs in response to changes in oxygen and carbon dioxide levels in the blood and nervous stimulation of the diaphragm and intercostal muscles. Second process is external respiration, the exchange of oxygen and carbon dioxide between the alveoli and the blood in the pulmonary capillaries. And third step is the transport of respiratory gases through the body by blood in the cardiovascular system. And lastly, there is the internal respiration, the exchange of oxygen and carbon dioxide between tissue cells and the blood in systemic capillaries. This figure shows the breathing muscles. A is the inspiration, which is air is drawn into the lungs. As you can see here, the diaphragm contracts and flattens. And B shows expiration. Air is forced out of lungs. The diaphragm relaxes and moves up. And now I'm going to talk about medical word elements. Combining forms in the upper respiratory tract. Nasal, rhino means nose. So nasal is pertaining to the nose. Rhinoplasty is plastic surgery of the nose. Plasty means surgical repair. Septo means septum. Septoplasty is plastic surgery to correct a deviated septum. Sinus means cavity. Adenoid means adenoid. Adenoidectomy means excision of the adenoids. Tonsils. Pharynx means pharynx. Epiglottis. Larynx. trachea. And bronch means bronchus, broncho, bronchial. Alveolus, Pneum, pneumo, or pneumono. These all mean air or lung. So pneumectomy means excision of all or part of a lung. Pulmo also means lung. So pulmonologist is a physician specializing in the treatment of lung and respiratory disease. Pleur means pleural. Other terminologies are anther means coal. Atel means incomplete. So atelectasis means partial or complete collapse of the lung. Coni means dust. Cyan means blue. Cyanosis is abnormal blueness of the skin and mucous membranes associated with the decrease of oxygen in the blood. Lobe means lobe. Lobectomy is surgical removal of a lobe of an organ. Orth means straight. Orthopnea means condition in which the patient experiences difficulty breathing in any position other than sitting or standing erect. Ox means oxygen. Pectorus, thorax, they all mean chest. Phren means diaphragm. Spire means breathe. Capnia means CO2. So hypercapnia means excess of CO2 in the blood. Osmia means smell. So anosmia or anosmia means loss of the sense of smell. Phonia means voice. Pnea means breathing. Apnea means temporary loss of breathing. Phthisis means spitting. So hemoptysis is coughing up of blood. Sputum from the lungs or airway. Thorax means chest. Pyothorax is accumulation of pus in the chest cavity. And now I'm going to talk about the prefixes. Brady means slow, so bradypnea is abnormally slow respiratory rate. This means difficult or painful. Dyspnea means breathing discomfort. U means normal. Eupnea means normal breathing. Tachy means rapid, so tachypnea, abnormally rapid respiratory rate. And now, pathology. There are common signs and symptoms of respiratory disorders. They are cough, dry or productive, chest pain, altered breathing patterns, breathlessness, cyanosis, and fever. Many disorders of the respiratory system, including bronchitis and emphysema, begin as an acute problem but become chronic over time. So chronic respiratory diseases are commonly difficult to treat and their damaging effects become irreversible. Pulmonology is the medical specialty concerned with disorders of the respiratory system. The pulmonologist is the physician who treats these disorders. First, COPD. COPD is chronic obstructive pulmonary disease, aka chronic obstructive lung disease. These respiratory disorders characterized by a chronic partial obstruction of the air passages. So, the COPD patient experiences difficulty breathing, dyspnea, unexertion. Unexertion means when you do activity, and often exhibits a chronic cough. There are three major disorders in COPD: asthma, chronic bronchitis, and emphysema. But currently, only chronic bronchitis and emphysema are included in COPD. Asthma is an independent disease entity. This figure shows COPD. A is chronic bronchitis. B. Emphysema. In here, C. Asthma is shown, but as I mentioned before, currently asthma is not one of the COPD. First, chronic bronchitis. This is an inflammation of the bronchi caused primarily by smoking and air pollution, also viruses and bacteria. Chronic bronchitis is characterized by swelling of the mucosa and a heavy productive cough, commonly accompanied by chest pain. There are several pharmaceutical agents for the treatment of chronic bronchitis. They are bronchodilators and other medications that facilitate the removal of mucus. These are called expectorants, help to widen air passages. And also steroids are commonly needed as the disease progresses. Second, emphysema. The emphysema is characterized by decreased elasticity of the alveoli. The alveoli expand delayed, but are unable to contract to their original size. So residual air becomes trapped, resulting in a characteristic barrel-chested appearance. This is associated with long-term heavy smoking. Orthopnea. Emphysema sufferers often find it easier to breathe when sitting or standing erect. As the disease progresses, no longer finds relief even in the orthopneic position. The treatment of emphysema is similar to that for chronic bronchitis. Influenza. This is an acute infectious respiratory disease caused by influenza viruses. There are three major viral types, type A, B, C. But nowadays, type D is also added. Type A, a primary concern. This is a primary concern because it is commonly associated with worldwide epidemics, which is also called pandemics, and is extremely pathogenic, virulent. The type A swine flu epidemic of 1918. This was responsible for 20 to 40 million deaths worldwide. Type B. It is usually limited geographically and less severe than type A. Both type A and B viruses undergo antigenic variations. Consequently, new vaccines must continually be developed in anticipation of outbreaks. There are several symptoms: rapid onset fever, chills, headache, generalized muscle pain, which is called myalgia, and loss of appetite. Usually, it takes about 7 to 10 days. The flu virus rarely causes death, and the case fatality rate is under 0.1%. Children should avoid using aspirin for relief of symptoms caused by viruses because there is an apparent relationship between Reye syndrome. This is a rare, rapidly progressive encephalopathy shortly after recovery from an acute viral illness, especially influenza and chickenpox, and the use of aspirin by children 2 to 15 years of age. Now I'm going to talk about pleural effusions. Any abnormal fluid in the pleural cavity, the space between the visceral and parietal pleura, is called pleural effusions. And when pleural effusions occur for the treatment is thoracentesis or thoracentesis. This is a surgical puncture of the chest to remove excess fluid from the pleural cavity using a hollow bore needle. Sometimes chest tubes are inserted to facilitate removal of the fluid. Two non-invasive techniques are used in the diagnosis of pleural effusion: listening to the sounds of the chest cavity with a stethoscope, which is called auscultation, and gently tapping the chest with the fingers to determine the position, size, consistency of the underlying structures, which is called percussion. There are several types of pleural effusions. If there is pus in the pleural space, that is called emphysema. If there is a serum, hydrothorax; blood, hemothorax; air, pneumothorax; and a mixture of pus and air in the pleural space, it is called pneumothorax. This shows thoracentesis. If there is a patient with pleural effusions, then the doctor uses syringe with catheter, removing pleural fluid from around the lung. Tuberculosis is highly communicable and spreads by droplets of respiratory secretions, aerosol transmission, or particles of dry sputum containing the TB organism. In here, TB means tuberculosis. The waxy coat of the TB organism allows it to remain alive, viable, and infectious for 6 to 8 months outside the body. Primary tuberculosis eventually produces unique focal granulomas called tubercles. Although primarily a lung disease, TB can infect the bones, genital tract, meninges, and peritoneum. Many of TB strains that infect AIDS patients are not responsive to standard medications, which is called drug resistant, and treatment commonly includes simultaneous use of several antibiotics, combination therapy. Pneumonia. Pneumonia refers to any inflammatory disease of the lungs caused by bacteria, viruses, fungi, chemicals, and other agents. Some fatal pneumonia is associated with influenza, food, or liquid inhalation. So food or liquid inhalation causes aspiration pneumonia. And also, currently, the COVID-19 causes some fatal pneumonia in some people. There are two types: pneumonia, lobar pneumonia, and bronchopneumonia. The symptoms are chest pain, mucopurulent sputum, and spitting of blood, hemoptysis. And the patient undergoes solidification, consolidation because of a pathologic engorgement. Now, I'm going to talk about diagnostic, symptomatic, and related terms. Acidosis is excessive acidity of body fluids. Anosmia. Anosmia means absence of or decrease in the sense of smell. Apnea is the temporary loss of breathing. Asphyxia. Asphyxia means pulse. So asphyxia is condition caused by insufficient intake of oxygen. Atelectasis is collapsed or airless state of the lung. Compliance means ease with which lung tissue can be stretched. Coryza means head cold or upper respiratory infection or common cold. Croup is common childhood condition involving inflammation of the larynx, trachea, bronchial passages, and sometimes lungs characterized by resonant barking cough, suffocative and difficult breathing. And debated nasal septum. This is a displacement of cartilage dividing the nostrils. Epiglottis. Epistaxis is nose blood, nasal hemorrhage. Finger clubbing is enlargement of the terminal phalanges of the fingers and toes, commonly associated with pulmonary disease. Hypoxemia. Hyp means under, ox means oxygen, emia means blood condition. So hypoxemia is deficiency of oxygen in the blood. Hypoxia is absence or deficiency of oxygen in the tissues. Pertussis is acute infectious disease characterized by a cough that has a whoop sound, which is also called whooping cough. Pleurisy means inflammation of the pleural membrane characterized by a stabbing pain. Pneumoconiosis. This is an occupational disease caused by inhaling dust particles. Pulmonary edema. Pulmo means lung, edema means swelling. So this is the accumulation of extravascular fluid in the lung tissues and the alveoli. Pulmonary embolus is the mass of undissolved matter. RAR is abnormal respiratory sound. Rhonchus, adventitious breath sound that resembles snoring, commonly suggesting secretion in the large airways. Stridor, this is high-pitched, harsh, adventitious breath sound caused by a spasm or swelling of the larynx. SIDS, sudden infant death syndrome, completely unexpected and unexplained death of an apparently normal and healthy infant, usually less than 12 months of age, also which is called crib death. Wheeze is a whistling or sighing sound on auscultation. And regarding the diagnostic procedures, there are several terminology. Monto Test. This is an intradermal test to determine tuberculin sensitivity. Oximetry is a non-invasive method of monitoring the percentage of hemoglobin saturated with oxygen. Polysomnography. This is the test of sleep cycles and stages using continuous recordings of brain waves, EEGs, electrical activity of muscles, eye movement, and so on. Pulmonary function studies. These are multiple studies test to evaluate the ability of the lungs. Spirometry. This is a measurement of ventilatory ability by assessing lung cavity and flow. Bronchoscopy. This is a visual examination of the bronchi using an endoscope. Laryngoscopy. This is a visual examination of the inside of the larynx. Mediastinoscopy. This is visual examination of the mediastinal structures, including the heart, trachea, esophagus, bronchus, thymus, and lymph nodes. As for the laboratory procedures, ABG means arterial blood gases. Sputum culture is a microbial test used to identify disease-causing organisms of the lower respiratory tract. Throat culture. This is a test used to identify pathogens, especially group A streptococci. Radiography. This is a producing images using an X-ray that is passed through the body or area and captured on a film. Scan, thoracic CT scan, and lung CT scan. Aerosol therapy. Lavage. Lavage means irrigating or washing out of an organ, stomach, bladder, bowel, or body cavity with a stream of water or other fluid. This is called lavage. Rhinoplasty. This is reconstructive surgery of the nose to correct deformities or for cosmetic purposes. Pneumectomy is an excision of a lung or lobe of the lung. Septoplasty is a surgical repair of a deviated nasal septum. Thoracentesis is a surgical puncture and drainage of the pleural cavity. The antibiotics are used to treat respiratory infections. Bronchodilators are very especially significant in the treatment of COPD and exercise-induced asthma. These bronchodilators relax smooth muscles of the bronchi, thus increasing airflow. These are delivered as a fine mist directly to the airways via aerosol delivery devices, including nebulizers and metered-dose inhalers. These are MDI, and they are delivered directly to the lungs. Dry powder inhalers that dispense medications in the form of a powder. Also, steroid and anti-inflammatory drugs, NSAIDs, can be used. Here, there are several drugs used to treat. Oh, these are an error. Okay, abbreviations. ABGS, arterial blood gases. AFB, acid-fast bacillus. AP, anterior posterior. CO2, carbon dioxide. COPD, chronic obstructive pulmonary disease. CPR, cardiopulmonary resuscitation. CT scan, computed tomography scan. CXR, chest X-ray. FVC, forced vital capacity. IPPB, intermittent positive pressure breathing. MRI scan, magnetic resonance imaging scan. NMTS, nebulized mist treatment, O2, oxygen. PCO2, partial pressure of carbon dioxide. PCP, pneumocystis carinii pneumonia. PFT, pulmonary function test. pH, symbol for degree of acidity or alkalinity. PND, paroxysmal nocturnal dyspnea. PO2, partial pressure of oxygen. RDS, respiratory distress syndrome. SaO2, arterial oxygen saturation. SIDS, sudden infant death syndrome. TNA, tonsillectomy and adenoidectomy. TB, tuberculosis. URI, upper respiratory infection. URI also is called common cold. VC, vital capacity. Okay, that's it. I'll see you in the third video for the week 2 medical terminology. Bye.